Inflammatory bowel disease, or IBD, is actually not a single disease, but rather refers to primarily two related but distinct diseases. One is called Chron's disease and the other is called Ulcerative Colitis, or UC. The key difference is firstly the location of the inflammation and secondly extent of the inflammation. Ulcerative colitis only affects the colon or large intestine, and Chron's disease affects the entire digestive system from gum to bum. In ulcerative colitis, inflammation is only on walls of inner lining, or we call the mucosa. In Chron's disease, inflammation can extend way through the entire thickness of the bowel wall to the outermost layer of the digestive tract. These differences lead to different outcomes and different treatments, which we will explain later. The major symptoms of the UC and Chron duo have an overlap. These increase stomach pain, changes in bowel habits, or almost, we can say, seem more urgent need to go to the toilet. Other symptoms include weight loss, decrease in appetite, high temperature or fever, night sweats and tiredness. These are trademark symptoms. But it is very important to remember that IBD can play quite differently in different people. The symptoms in IBD can come and go over long periods of time. People may explain periods of severe symptoms, which we call flare-ups, and sometimes patients may have periods with no symptoms, commonly called remissions. IBD can occasionally affect or inflame the other parts of your body, such as your eyes, skin, liver and joints. Other symptoms can be more specific. For example, because ulcerative colitis only affects the inner lining of the bowel. We can see mucus and blood in stool, but in Chron's inflammation, the whole bowel wall. Maybe blood, but also significant abdominal pain, nausea and vomiting. Both diseases can delay the growth in children. Chron's disease and UC happens in some sort of environmental factors. Susceptible and visual causes, immune system of the body defense against action to malfunction. This immune system attacks healthy tissues inside the digestive system, leading to the inflammation. Currently, there is no cure for IBD, but many of the treatments that effectively target the immune system, so medications such as corticosteroids or 5-ASA, which helps to reduce inflammation, or immunosuppressants, to reduce the activity of the immune system. Medicine called biologics have become a key treatment option for those moderate to severe inflammatory bowel disease. They work by using specific developed antibody to selectively block the effects of molecules surrounding the wall of the inflammation of gut wall. The idea here is that we can move beyond symptoms management, the mucosa lining, which can lead to remission and prevent relapses. In Chron's disease, results are in patches of inflammation in the lining of the intestine with groups of small ulcers, similar to mouth ulcers, that can occur anywhere in the digestive tract. However, in moderate to severe Chron's disease, these ulcers become much larger and deeper with a lot of surrounding redness. The inflammation can make the intestine become thickened, blocking the passage of digested food. In some cases, deep ulcers break through the wall of the intestine, causing infection outside the bowel, an abscess. And this can then spread to the skin or a nearby part of the body. This is known as a fistula. The main reason for needing surgery is to remove the inflamed section of the digestive system. Self-awareness is also important when it comes to men in stress, unpredictability of IBD, or dealing with symptoms. At the same time, dealing with life's other stresses can be incredibly tricky to navigate. Inflammatory bowel diseases can have a profound effect on an individual's life, physically, emotionally, and socially, both at home and at school or in workplace. Although there is no cure yet, but many treatment options are available. Thanks for listening and take care.